is brought to you by South Central Regional Medical Center in Laurel.
Healing wounds, changing lives. That's the mission of the Wound Care Center at South Central Regional Medical Center. An estimated 8 million Americans suffer from chronic wounds, and many of those are patients with diabetes. Case manager Don Mullen says there are simple things these patients can do to avoid getting wounds.
Make sure you wear the correct shoes. Too big a rub. If you have rubbing, you're more than likely going to get a diabetic foot ulcer. They need to check their feet at least twice a day, once in the morning when they get up and once before you go to bed, in between the toes, all around the feet. If you also have any neuropathies with high glucose levels, your nerves aren't what they used to be, so you don't feel things. You could step on something and never know it. It starts out with an infection. From there, it can be an amputation. The mortality rates on an amputation, about 5 years when it's a lower leg.
This was a fate Steve King was facing following the 5th surgery on his right leg until he came to the Wound Care Center at South Central.
I had gangrene set in. I had a serious wound. It was a hard road, but as of this day, I'm healed, no open wound anywhere, and it's just because of the care I received, I think, at the wound clinic.
Mr. King underwent many different forms of treatment, including hyperbaric medicine.
At that point, we're getting oxygen to places, wounds that normally don't get as much oxygen. Bottom of a foot, infected diabetic foot ulcer. We get that oxygen down there to it, and we've had great success.
They didn't quit with just one treatment. You know, they kept going until they got me well.
To make an appointment at the Wound Care and Hyperbaric Medicine Center at South Central, simply call 426-4739. For HealthBreak, I'm Catherine Farah.
HealthBreak was brought to you by South Central Regional Medical Center in Laurel.